I'm James Taylor, and I actually hurt my back in Daytona riding motorcycles during bike week. Come home, went and seen the chiropractor. Just thought it was something he could take care of. Long story short, after about, 2 months of going and seeing Dr. Dixon, it didn't get any better. So he walks in one day and I ask him to straight up, be honest, you gonna be able to fix this problem or not? Goes out, gets my x-rays, brings them back in, says, man, needs to see a surgeon. I ask him who. He really doesn't say. So we start looking. We go to, I believe it was the Vanderbilt Bone and Joint Clinic in the beginning. They done MRIs, couldn't find anything. I think they were basically, gasping at strings. Put me on Lyrica, which is some kind of medicine to kill the pain. So that wasn't getting anywhere. I needed a fix. So we quit going seeing those people. Went to Columbia, to the Bone and Joint Clinic over there, Middle Tennessee Bone and Joint. They about the same way as it was up there. So, at this point, it ain't gonna get any better. I don't know. Good friend of mine, Jim Patterson at Dixie Diesel. Dr. McCord had just fixed his back. Jim calls me and tells me after he comes back to work how good he was feeling, so I made an appointment to come see Dr. McCord. Talk to him, he does the MRIs, the discogram, CTs, all that, tells me what I need done. So I go for a second opinion, I see Dr. McCombs. Same thing he says. The difference in the two doctors, McCombs says I'd be out of work 6 months. Dr. McCord says no more than 3. Actually, I was back to work 2 weeks and 7 days. So, if anybody's considering back surgery, anybody I know, I send them to see Dr. McCord for the simple fact that he's going to put you back to work quicker than anybody else. I guess it's the procedure or his knowledge, I don't know. Just my personal opinion, he's a pretty smart man. He found my problem real quick, and I'd seen all these other people for several months and nobody ever found the problem. So my personal opinion, that's who I send everybody to. Got several people, I know lots of people that's had back surgery, and it was out 6 to 8 months before they could go back to work. They're still on pain pills, they're still going to, pain management. I'm fortunate. I think it's 8 or 9 weeks now since I had back surgery. I'm limited to the pain medication I take. Take it once a day in the morning when I get up, due to the fact that I'm stiff and sore from sleeping all night. Don't have to have it the rest of the day. Muscle relaxers, I still take those on a 3 times a day basis. Hopefully it's getting better. I don't have to take as many as I did before. So, I feel like in 3 months that I'm gonna be totally off everything. That's what I'm shooting for. And get to ride my motorcycle again, because we hadn't rode motorcycles in about 1.5 years now since I blowed my back out in Daytona. So, that's just my feeling about the situation. Is anybody wants to be fixed and go back to a normal life, they need Dr. McCord to look at your situation. Dr. McCombs goes through the back only. And my understanding from what he told me was the healing time is a whole lot longer, because he actually, when they go through the back, instead of doing like Dr. McCord going through the front and putting the cages in through the front, McCord and McCombs both explained to me how this works. If they go through the back and cut it, they have to actually cut bone out of the way to get in there to replace the cages, to put the cages in. McCombs, is McCord situation, you go through the front, you put the cages in, then you go through the back and you fix the back. McCombs does it all through the back, so therefore that's why you're down longer on the healing time, because they actually cut the bones in two to replace the cages, or to remove the disc and put the cages in. That's why I didn't want that, because faster I can go back to work. I'm a self-employed person, so the faster I can go back to work, the better off my family is. The longer I'm laid up in the bed, the less money I got coming in other words, So that's the reason I picked Dr. McCord, was the length of time, the recovery time of how they went through the front and removed the disc and put the cages in, and then opposed to McCombs. And we seen another surgeon, I forget his name now, but they went through, their procedure was through the back only. They just go through the back, they cut the bones out of the way, they put the cages in, remove the disc, and to me, when you start cutting stuff out of the way that don't need to be cut out of the way, it's just a longer process of healing, even if you are gonna heal 100%. When McCord told me that how they went through the front, and he would cut your hip to get the bone marrow to pack in the cage to replace your disc. So you end up with 4 scars basically, or I did in this situation. Maybe not everybody's that way, but I did. I ended up with 4 scars, 1 down each hip, 1 in the front, 1 in the back. My opinion, I'd rather have the scars as have 1 scar up the back and still be in pain. That's just my thinkings on the situation. Each person's different. Everybody's going to heal different. I'm fortunate that no longer than it has been for me, and I'm back to a normal day in my business. I can do anything I want to do. And I asked Dr. McCord, I says, how much can I do? And he tells me at 3 weeks and 1 day when I was in his office, go back to work. If it hurts, don't do it. I said, do anything I want to do. Do anything you want to do, because if it hurts, you'll know it. Don't do it. And I done some stuff, and yes, it did hurt, but no pain, no gain situation. You got to learn what you can do. Don't sit on the couch and babysit it. There's a lot of people think, oh, they tell me 3 months, that's how long they're going to take. Oh, it's going to be 3 months before I can do anything. They're not going to try to do anything for 3 months. I'm not. I would, like I say, I've recommended several people, and actually personally bringing a dear friend of mine to see Dr. McCord on the 4th of next month that has had 3 back surgeries by other physicians, and he is actually bedridden. He can only get out of the bed 2 days out of a month. And I want Dr. McCord to look at him, see if he can do anything for the man. He's 54 years old, I believe he is. And he's had 3, and every time he'll do good for a couple of months and then right back in the same shape. And that's, I've asked Dr. McCord, and his problem is he's kind of scared because his insurance, Dr. McCord's not on his network, but I told him, I said, go see the man. It'd be worth money out of your pocket to get fixed if he can fix you. The good thing about it is Dr. McCord, straight up, he's going to tell you. He's not going to candy coat it. He's going to tell you exactly how it is, and if he can or if he can't fix you. And like I told him, this is a one-time shot. I don't care what you got to do, fix it while you're in there, because I don't want to go through it again. First 2 weeks is pretty rough. I ain't gonna lie to nobody about that. That's about the most intense pain I ever been in, but 3rd week it started turning around. Like I say, 2 weeks and 7 days I started going back to the shop and going back to work. I was in some pain, but I went on back and pushed the bubble a little bit. Like I say, everybody's different. Some people just lay around there in pain, they're gonna take pain pills. Not me. I don't want it if I can keep from it. But there again, that's my opinion. That's Rick's thing, is he's a super nice guy, do anything for you can. And he tells me that he hurts so bad that he wished they'd paralyze him so he wouldn't be in pain. And and I tell him all the time, I said, Rick, go see Dr. McCord. So I got it set up so he comes and sees him next month on the 4th. I told Dr. McCord, I asked him if he'd see him when I come in to see Doc. And he said, yeah. And I said, the situation is, told him the situation. And he said, and that would be great. So Rick's got all of his MRIs and everything they've done in the past. Told him, I said, get it all together and bring it with you, so he can just look at it. He's gonna tell you right straight up whether or not he can or cannot fix you. I said, he's not one of these, I don't believe he's a doctor that will tell you he can fix you, get in there and then, you're not no better than what you was. I don't think he'll open you up and do that. That's just my opinion, but I talked to several people before I'd actually let anybody cut on me, and you can ask my wife or Dr. Dixon or anybody. After the first time I walked in McCord's office and talked to him, that was about the most comforting, I should say, that I had felt about anybody I had talked to, because I didn't like the way anybody else had talked about what they were going to do to my back, how long I'd be down, or what I'd be limited to after surgery. Felt more comfortable. So, I guess if I had to have back surgery again, I know where I'll be going. Hopefully I don't, but if I do, I know where I'll go.